Alaska. Oh, I'm a radiologist doing injections that a primary care is telling me to do. Because I see that day in and day out. I get it from insurance companies where like, oh, you already had 3 injections. Like, what does that even mean to you? What does an injection mean? It means nothing unless it's in the right place. An epidural steroid injection, when you have facet-mediated pain, it's not going to be the right procedure. And so I think that my hope with the future is that there's actually a tightening on who does procedures, but a loosening on maybe what procedures are done. So I think, again, it comes down to having the appropriate docs in place and the appropriate docs trained. And not just, if you take a doc that's a family practice doc that buys a C-arm and goes and gets taught at a Stryker course on how to do RFA, there is zero question in my mind he is learning that to make money. If you're doing a residency and a fellowship in interventional pain management, sure, you might be doing it because you're like, oh, this is going to make a lot of money, but you're not going out and trying to just learn some course on a weekend to do this. It's like there's a greater understanding of what you're treating, like the whole person. It's not just there's a disc, I need to inject it. It's not just there's a facet joint, I need to inject it. It's, understanding the whole aspect of pain, understanding the person, understanding is the psychological. So much psych is involved in pain management. It's unbelievable. And so, when you I see it all the time, family practice docs ordering injections, done by radiologists. I'll pull up the images that the radiologist did. It's not even the right level, the wrong side. It's like they don't care at all. It's not their patient. They're just sticking a needle, sending a code, getting paid. They don't care at all. And so I think that, what I would see is, with the improvement in the volume of interventional fellowship-trained, HTME fellowship-trained pain physicians that's coming out into the country, and also that coupled with the understanding that opioids are not a good long-term option, there's going to be a lot of, improvement. There's going to be a lot of technological advances, and I think a lot of opportunity as well for technological advances, because what I'm already seeing is loosening of, not just research, but also of money to fund the research. Everybody's looking at, how can we get money? There's a ton of money out there because of the opioid crisis. So I think that will drive research, and I just hope that the research that is driven is going to be, the appropriate therapy and not just, who's got the best, VP of marketing that can get the VC guy's attention to say, hey, yeah, I'll give you $40 million to move this to a Series B or whatever round of funding. So, yeah, I think that it's a great time to be in my specialty, and I think it's going to continue to improve. We've already seen, CMS releasing improved numbers for reimbursement, whereas, they've historically been draconian cuts. So we're seeing some reversals in that, reversals on the sides of the ambulatory service centers. So, yeah, I think it's improving. I would like to see a restriction on who can do them, who can submit these codes. But, I think that's a bigger kind of conversation.
Understood. Well, Dr. Davis, that was... Oh, absolutely. Yeah. No, you knocked it out of the park.
Okay. I could talk about this all.
Well,
it's like a passion for me that appropriate things are done to the appropriate people. I mean, because it's one of these things. It's like you heard from my initial discussion. We do a lot of volume. I did 25 procedures this morning before our phone call. The difference is, of those 25 procedures, I probably saw 75 to 80 people. So it's like it's identifying the right patient, and that's where we do a lot of procedures, but we have a ton of volume, and so it's not every person walking in is walking out with a procedure. I'm sending a ton of people to just physical therapy. I say it all the time. I've got a herniated disc in my neck. I'm like, have I had a shot? Hell no.